So I'm going to enter a Citizen Spotlight, the city's only nonprofit news organization dedicated to local, independent, political, and business reporting in the South Bay. We'd like to first thank our sponsors for making tonight's programming possible. Office of Santa Clara County Supervisor Otto Lee. Valley Physicians Group, the Health Trust, Stanford Healthcare, Gardner Health Services, Valley Health Foundation, Stanford Children's Health, Santa Clara Family Health Plan, Santa Clara County Medical Association, Healthier Kids Foundation, and the Community Health Partnership. A big round of applause for them. Now, I'd like to introduce our host for tonight, Santa Clara County Board Supervisor, President Otto Lee.
Well, good evening, everybody. Thank you for being here at our INS auditorium. Some of you have never been here before. This used to be the old chamber of Santa Clara County. We have a little nice one now next door, and you get to see us on Tuesdays and whatnot. But first of all, thank you and welcome to our county tonight. My name is Otto Lee, currently serving as the board president, representing our beautiful Santa Clara County. Of course, we are also the largest county in Northern California, with over close to 2 million residents and over 23,000 staff members working in our county. It is truly wonderful to welcome all of you to our county center here. It is so imperative for us to all be engaged on this vital issue. And many times we debate all that stuff. Very few times it's life and death. This is one of those times. Such as our local hospitals are being impacted by HR1. I want to express my gratitude to San Jose Spotlight for organizing this really important event. And I'd like to also thank our moderator, Morgan Rhino, for leading today's discussion on such thoughtfulness. San Jose Spotlight has played a critical role in our region, not only by delivering timely information to our residents, but through creating opportunities like this, giving us a chance to come together and address the most pressing challenges that we're facing as a community. Today we're gathered here to discuss the most important urgent issues that we face. The funding of our county's hospitals, which is now under threat because of HR1, as some call it big beautiful, but now we've realized pretty hard to go. At national level, HR1 will cut an estimated $300 billion, yes, per B, from essential services, which includes behavioral health care, food assistance, social services, public health programs, child welfare, housing, and public safety. These are the very programs that our veterans, working families, some of our nation's most marginalized communities depend on. These are the services that so many people rely on simply just to live. As our community members may already know, the impact of HR1 will have devastating here right in the county and will be felt by every individual regardless of age, gender, race, or income. The current federal government and environment has posed extreme risk for our county and the critical safety nets the county provides. And I've said this many, many times, HR1 has punched a huge hole in our safety net. So as it stands, the county of Santa Clara is raising for more than $1 billion a year of lost revenue over the next few years. We're talking about $1,000 million a year. So this extraordinary fiscal situation will have direct and profound consequences for our county health system. Our county health system operates 4 hospitals and 15 major health clinics, responding to 911 calls every 11 minutes and provides care to 1 in 4 of our county residents. Further, our health system handles 80% of trauma cases in the county, operates one of the 3 regional burn centers between Los Angeles and our Oregon border. So if you really got hurt, if you got burned in this county, our gratitude ties are even kept, right? Because only a county trauma level 1, level 2 centers are the ones that could really heal you from the burn center we talked about. Our county health system is made of heroes who work unbelievable hours in very tough and demanding conditions, who have guided and protected all 2 million of our county residents through the terrors of COVID-19 pandemic and beyond. And it is for all these reasons and more that my board colleagues and I have unanimously approved a proposed sales tax measure for voter consideration this coming November in a very short manner, this past August. The proposal is a 5-year, 5/8 cents, not 5%, 5/8 of a cent tax increase for our county, generating approximately $330 million of new revenue. Hoping that this will help cut off some of the losses that we would have to mitigate. But when we're losing $1 billion a year, 330 million is only about a third. A lot of cuts will still have to happen even if this were to pass. Above all, our hospital strength comes from the people, from the CEO Paul Lorenz said right here next to me, and also all the doctors, the nurses, the PAs, the therapists who have dedicated careers to serving others in time of need. These individuals, these heroes, deserve our gratitude and our support. Let's give them a big round of applause. These healthcare workers have supported all of us on those dire times deserve our support so that they can continue this important work. Everyone in this room and beyond also did a thanks to these healthcare heroes. It is beyond time that we as a county and community do all that we can to make sure they feel empowered to continue this difficult but vital work. Thank you for being here to learn, to listen, and staying with the people and the providers who make Santa Clara County such a special community. So now it is my pleasure, true pleasure, to introduce one of my everyday heroes, Dr. Fahad Khan from the Santa Clara County Medical Association. He's a neurosurgeon for the El Camino Hospital. Dr. Khan is committed to alleviating pain and suffering of his patients, as well as curing them whenever possible. He specializes in brain surgery, really, a brain surgeon. He's that smart, including trauma and tumors, as well as spine surgery of the neck and back. Dr. Khan also has specialty training in spinal cord stimulation, deep brain stimulation, epilepsy surgery, and surgical pain management. So let's welcome Dr. Khan to the stage.
So good evening, everyone. Thank you, Supervisor Aruli. So again, my name is Fahad Khan. I'm a neurosurgeon in solo private practice. I do go to El Camino. I go to Good Samaritan as well. But also very importantly, I'm a physician at O'Connor since 2012. So I've been taking care of county patients, and before that, the patient population at O'Connor as well. So I have the privilege here of serving as president of the Santa Clara County Medical Association. We represent more than 4,800 physicians across Silicon Valley, from solo practices like mine to large health systems, all united by the same mission, advancing the health of our community. I want to thank San Jose Spotlight for hosting this important conversation. Silicon Valley is home to world-class hospitals, groundbreaking research, and physicians who care deeply about their patients. But here we face real challenges: rising costs, workforce shortages, funding cuts, and persistent inequities in access to care. That's why it's so important for physicians to be part of these discussions. As someone who meets with patients every day, I see firsthand how policy decisions and systemic barriers impact their lives. Our perspective is vital if we want solutions that actually work for the people we serve. Tonight is a chance to ask hard questions. How do we protect access for every resident? How do we sustain our health systems? And how do we make such innovation help close, not widen, the gaps in care? On behalf of SCCMA, thank you to San Jose Spotlight, our moderator, the panelists, and all of you for being here. I chose to practice in San Jose because I believe this community, and I believe that together we can build a healthier, more equitable Silicon Valley. Thank you.
Thank you, Supervisor Lee and Dr. Khan. One last note. If you have have an interest in asking a question, we are going to allow about 10 minutes at the end for audience questions. If you raise your hand, they can hand you a card and you can fill it out. If you raise your hand again, they can pick up your card and we can look and read your question. Thank you. Okay, let's get started. This evening, we are going to talk about the various healthcare services provided to the community and address some of the most pressing issues affecting our county healthcare system. And it is my pleasure tonight to be here with such a well-versed panel who can talk on these critical topics. Our county is on the cusp, as you heard from Supervisor Lee, of losing nearly $1 billion in Medi-Cal revenue over the next few years due to federal tax cuts. And then watching it skyrocket up to a total of $4.4 billion in lost revenue by 2030. This is the result of, as you already heard, President Trump's One Big Beautiful Bill passing in July, also known as HR 1. Our expert panel today will talk about what this means and what's next for our county. So finally, joining us tonight, I will now introduce you to this. First we have CEO Paul Lorenz, CEO of Santa Clara County Healthcare, who oversees the county's 4 hospitals and 15 clinics. Next to him is Megan Lillahan, the Deputy Director of Santa Clara County Behavioral Health Services. Rachel Louise, board-certified pediatric gastroenterologist who chairs Valley Physicians Group, a labor union representing physicians and other medical professionals employed by Santa Clara County. Then Dolores Alvarado, CEO of Community Health Partnership. Dolores oversees a unique partnership with 9 different nonprofits that serve as essential safety nets for the area's most vulnerable residents. And Patty Beebe, a registered nurse in Santa Clara County and a representative of the Registered Nurses Professional Association. Thank you all for being here today. Round of applause. So we are really fortunate to have a wealth of healthcare providers and services in our county. Public healthcare, nonprofit healthcare, and for-profit healthcare. On the public front, Santa Clara County Healthcare is the largest healthcare provider in the area and the second largest healthcare system in the state. Only Los Angeles has a larger system. So what does it mean when the federal government pulls billions in funding from our healthcare system? What does it mean for our community when healthcare services like the Community Health Partnership and for the physicians, the clinicians, nurses treating patients and caring for patients, and all the residents in this county, whether they're insured or not, what does this mean? To understand the impact of this funding loss, it would really help to explain how important the services are in our community and what they're about. So I'm going to ask each one of you to briefly, in 3 minutes, which I know isn't much time, to explain the county services you provide or the county care that you provide. And in front of me is Annalise, and she's going to hold up that little timer, so we stick to our 3 minutes a piece. Okay. So the first thing, and of course, Paul, I'm going to start with you. Since you oversee the county's healthcare system, could you give us a brief rundown of the county's services over and above primary and emergency care, including critical specialty care so many residents depend on? And can you help us understand the scope of the need? How many residents are seeking out our care? You have it. Here's the microphone.
Thank you very much, and it really is a pleasure to be here with the panel and everyone here in the room. Let me just start out by giving just way of background. My microphone.
Yeah, exactly.
So I've been in public I've been very fortunate to serve as the Chief Executive Office for what I consider to be one of the premier public health care systems in the state of California, and frankly in the nation. Let me give you just a bit of information. So of course, Valley Medical Center is a flagship hospital. At that hospital, we provide obviously acute care services. But a lot of people do not appreciate is the type of specialized services that we offer. We talk about emergency room care. We talk about trauma care. Valley Medical Center is a level 1 trauma center for adults, but it also is a level 2 trauma center for pediatrics. The reality is that beyond that, we also offer a burn unit, a regional burn center that serves not only our community, but frankly the region. And it is the only burn trauma center in Santa Clara County, but it is one of 3 between LA County and the Oregon border. A lot of people do not appreciate what specialized services we offer in that respect. The other area that a lot of people do not appreciate, in many instances, just like most hospital services, if you as an individual or your family member needs a specialized services, you don't appreciate that they exist. So we do operate on the West Coast, the #1 rehabilitation center for spinal cord injury, for brain injury, for stroke. We also operate at Valley Medical Center, the only psychiatric emergency service that is a 24-hour long facility serving all residents in our county. There are many other services from an outpatient specialty standpoint that we're very fortunate to have. They range from surgical specialties to medicine specialties. We probably have the largest network, a group of specialists in the county, and clearly the largest for public hospitals. And these services are offered to every resident in our community, every resident. All of our services complement other safety net providers in the community. We have representatives from a number of different community health clinics throughout the county here. But the reality is that without hospital-based services, we do not have the full continuum of care. So it's really important to understand we as a hospital, the 4 hospitals, complement other safety net care providers, right? That's how you have an ecosystem, that's how you have a full continuum of care. For preventive health care, primary care, all the way to acute hospital services, to specialty services, to subacute services. I want to add, and I know my time is up, but let me just say this to all of you. When you operate 4 hospitals in public system that provides for 50% of the emergency room care in the county, 50%. That's 750 emergency room visits a day, 275,000 emergency room visits. Think about what impact this will have in terms of the loss of funding. We received $2 billion in funding through Medicaid, just through public hospital system, $2 billion. We stand to lose $1 billion in funding because of HR 1. $200 million this year, $500 million next year, and then by year 3, we're looking at over $1 billion in lost revenues that would impact the system. So with that being said, I'm sure there will be other questions, but I'm going to turn it over to my other panelists.
And you need to say something after other questions.
I'm sure it is.
Megan, Megan, can you briefly describe the behavioral health services the county provides? Another small request.
The county Santa Clara Behavioral Health Services Department serves some of our community's most vulnerable residents. This includes medical beneficiaries, people without access to benefits who cannot afford their own care, and who need specialty mental health services or substance use. Many of our beneficiaries experience homelessness, institutionalization, incarceration, have trouble accessing safety net services because of their conditions. The HSC is part of the county's larger health system and works very closely with Santa Clara Valley Healthcare, hospitals and clinics to provide coordinated and comprehensive response to the community members' needs for mental health and substance use treatment. We support a network that includes 124 mental health clinics, 26 substance use treatment clinics, and 24 dual or co-occurring clinics. VHSC also operates the county's 98 crisis and suicide prevention hotline, which answers thousands of calls every month and almost 200,000 calls annually. We also offer the larger community mobile crisis response services, which provide anyone experiencing a behavioral health crisis in the community with caring and effective interventions and infectious services. Our department manages an integrated network of mental health, substance use, and co-occurring treatment services to help beneficiaries achieve the best possible outcomes. Last year, we provided almost 30,000 people with mental health services and more than 4,700 people with substance use treatment services. This has a remarkable impact on our community. The majority of these services are delivered by our Valley County contract providers whom are with us here today. And we also operate a system of dedicated mental health and substance use treatment clinics. Together, we provide people the care that they need to recover and achieve their hopes and dreams. VHSC is Santa Clara County's Medi-Cal plan for the provision of specialty mental health and substance use treatment services. What does that mean? Well, in California, services to treat serious mental health disorders and substance use disorders are carved out of the regular Medi-Cal managed care plan benefit and managed directly by the counties. Counties use Medi-Cal payments along with local funding to provide the vital services that beneficiaries need. 88%, or over 29,000 of our 31,000 beneficiaries have medical. The rest are people without medical who cannot afford their own care. Because VHSC's programs serve so many medical recipients, and the medical revenue that we receive is our largest funding source, we are very excited about the impacts of future money.
Thank you very much. Rachel, can you tell us the size of Valley Valley Physicians Group, and could you point out some of the various specialties and medical professionals who make up the union and the type of work?
Good evening, everyone. So my name is Rachel Reese, and I am born and raised in Santa Clara County. I grew up here, actually grew up in Gilroy. I'm the first first person in healthcare in my family. And so for me, coming to work here at Santa Clara Valley Medical Center was personal, and it was a way for me to give back, and it was a dream. I completed my fellowship in pediatric gastroenterology at Stanford, and being trained here in Silicon Valley as a trainee, you can pick wherever you want to go. You can go to UCSF, you can stay at Stanford, Kaiser, but for a lot of us, we fall in love with Valley. And we fall in love with Valley because of the patients. We love our patients and our colleagues. And I've been here ever since fellowship. I've been here for just about 6.5 years now. And I am chair of Valley Physicians Group. We represent about 450 of the county's physicians, podiatrists, and dentists. And so our work spans, and we're at every hospital and every county satellite clinic. We do everything from primary care to trauma to elective surgeries, and myself, I'm a pediatric gastroenterologist, so when a 2-year-old swallows a button battery in the middle of the night, I'm running and rushing to the ED and taking that kid to the OR to remove it. Similarly, if a child my time coming in and helping that child. So for us, physicians, podiatrists, and dentists, again, I cannot stress this enough, we were here during COVID, whether we were in training or already practicing, and we're here to stay, and we're here to serve, and the impacts of HR1 are going to be, it's hard to even look into a crystal ball really to see, but it's going to be, COVID was a dark days for us, and we are envisioning some dark days ahead of us with really no end in sight unless we really come together. And so that being said, we are here and we don't want to go anywhere, regardless of how sick our patients are or what state of health they're in.
Thank you. Dolores, you have multiple community health service centers under one umbrella for some of the most marginalized residents in the county. There's primary care, dental care, mental health services, support groups, family planning, case management, health education, nutrition care, outreach, and prenatal services. Could you talk about the role these community centers play and how they intertwine with the county?
Thank you very much. I would like to start by thanking Spotlight. And I want to make sure my voice is in. Thank you very much, Josh. And what I'm the last time I sat here was 1994, and it was not a pleasant experience at that point. I want to start off by telling you a little bit about my professional career from this perspective. I feel that I'm one of those pros that has my hands and my feet in everything. For example, I worked for the county as an era for 20 years, public health. I was the first chair of the financial government event that everybody contributes to. I was the person who helped one of the supervisors write the annual health assessment version 1.0 back in 1998 or something, etc. And I fell in love with I just want you to, what I'm trying to say here is that I can see both sides of it. And that is one of the reasons that I love this job, because there is this very tight relationship that really helps patients, because if we cannot serve them, then possibly all can serve them instead. So that's the beauty of this tri-coordination. I'm also on the board of San Francisco Health Plan, which also brings in another piece of information. I need how that works. So what I want to talk about community health partnership and how we work, and later I'll talk about the clinics a little bit more. This organization is an advocacy organization. We are not doctors, nurses. We are all primarily masters in public health and policy folks. It was funded by the city of San Jose, ironically so, in 1993. In addition to the 9 agencies that we referred to, which in total see about 300,000 people a year, over 1 million encounters, and if you add the others that work outside we have an informal partnership with them. We have programs in our community access to demographies, which Paul has helped me with quite a bit. They are talking closer to 2 million members. We also work in San Mateo, Monterey, Santa Cruz, San Diego, and really the issue here is to bring forward a very unusual perspective that community things have. Born from the need to stop the high rates of infant and maternal deaths in the southern United States, that specifically, and fueled by civil rights movement, the neighborhood health center movement came to be. We continue that movement through our healthcare. When people talk about health equity and health disparities, that is who we are. Oh, thank you. Now you got me going here. That is who we are. we were born into the health equity movement that did not use the term health equity. If I may be kind enough to take another 30 seconds, may I?
30 seconds.
Yeah, 30 seconds. Today, 32 clinics belong to a community health partnership, 32 sites. These 32 are in San Jose, then we have another 15 between San Mateo and other Park Gilroy, etc. So there's close to 50. These clinics engage in approximately 2 million encounters when you take all of them per year. That is incredibly high. What brings folks to the community health centers is the cultural piece. The clinical piece is very important, there's no question. But what you will find in the community health center, the minute you walk in, you know exactly, this is the clinic based on roots from, look at roots, and look at Bach, and look at Gardner, from a very distinct cultural perspective. It is not one size fits all, so it's very difficult for me to talk about the clinics as one, because they are all, it's different as your, I can't sign it. So I'm going to stop now. There's more I can address it next time. Okay?
Thank you. Patty? As a registered nurse, what's that? Patty, as a registered nurse with more than 2 decades working at the MC, could you tell us about the various nursing skills needed at the 4 hospitals?
Okay, I was wondering what the question would be. I've been enjoying all the information and these amazing folks here. So what are the skills needed? That's kind of varied, depending on where you are. Everybody kind of finds their own niche. I can tell you that when I came to Santa Clara Valley Medical Center, when I came to San Jose, I was coming from Fresno, and I previously worked at a county hospital there. And when I came here and walked into the county hospital here, I was just amazed, because it's like, this is no county hospital I've ever been in. And it became clear very quickly that this county hospital was well supported by the residents of the county, by the county board of supervisors, and healthcare is a priority. And public health is a priority. So one of the things that I very much enjoy about Santa Clara Valley Medical Center and the whole health system, we are teachers. In every respect, I work in nursing, and we work with the nursing schools, and I hear over and over again how that attitude of the nurses and the skill of the nurses and how well they teach the next generation. I've heard this about the physicians as well as you do here. So, yeah, I have a variety of experiences, but everybody kind of finds their niche within the county, and this is an excellent place to work. And I can tell you, for the nurses, I'm not an official representative of RMPA, but I am a member. And I know that the nurses don't quite yet know what's coming as far as the budget cuts. And if they did, they'd be a lot more nervous about it. Worried about their own livelihoods, of course, but also very concerned about their patients. Very concerned about their families, their communities. My family members, as these folks were talking, I was remembering my son was seen by a pediatric GI doctor when he was a kid. My husband that was in ICU at St. Louis. Another family member that was in EPS. All part of my family, and everybody here knows somebody that has been a patient or part of county hospitals.
Thank you. Okay, so this gives you a pretty clear picture, I hope, of how significant the community healthcare system is, the public community healthcare system is, and as you heard from the panelists just now, how serious the future can be. So what we're gonna do is, understanding that, we're gonna move on to, with the funding crisis that we have, how are we gonna face it? So, Paul, of course, I'm coming back to you. And you are right in the bullseye of managing the public healthcare system's future. About 30% of the county's $14 billion budget is in the county healthcare system. And the county barely has a year to figure it out. With 2 fiscal years taking a sharp turn down financially, and nobody is sugarcoating that. County Executive James Williams said the other day, HR 1 has cut a seismic tear into our social safety net, and he called the magnitude extraordinary, and you said pretty much the same thing. Can you explain to our audience the impact of those cuts due to the losses in billions of dollars in Medicare funding, which is much bigger than the 485,000 residents potentially losing their Medicare coverage? What is the cascading effect of all this?
Yes, thank you for that question. So let me start out by giving some numbers. I think everyone can appreciate when I speak these numbers how devastating HR one is to the system. For the 4 hospitals, the 15 health centers, and the multitude of specialties that we offer, we have an operating budget of $4.6 billion. $2 billion, as I mentioned, is Medicaid. We stand to lose $1 billion in Medicaid funding, Medi-Cal in California. That's basically 1/4 of our operating budget. Most of you appreciate the fact that the 4 hospitals we were talking about, St. Louis Regional Hospital, Honor, now Regional Medical Center, and then, of course, we all know about Valley Medical Center. The reality is that there's been a lot of discussions about hospitalization, right? Because when you talk about $1 billion, something has to give. Now, I would tell you that in most healthcare systems, you look at service lines where you don't have the margin that you would otherwise have. In a public healthcare system, people have to appreciate the fact that in many instances, we offer services that no other hospital system chooses to provide because of the lack of revenue. We are going to be put in a situation where we are going to have to make difficult decisions around service lines that really serve our most vulnerable members of our community. Think about that. And we're talking about this year, $200 million, next year, $500 million, and then we reach that $1 billion. When you have a public system that 60 to 70% of the Medi-Cal population depend on, and what a lot of people don't appreciate is that your public system also serves the largest percentage of Medicare beneficiaries in terms of hospital acute care services. So Valley Medical Center's payer mix is around 48% Medi-Cal and 40% Medicare. So we're talking about the Medi-Cal population impacting the lost revenue, but this system serves Medicare patients as well. So think about that. Medicare, Medi-Cal, all individuals on government subsidized health coverage programs. So we're not just talking about children, we're not just talking about adults, but we're also talking about our seniors. This cuts across the full spectrum of individuals that will have difficulty in accessing care. healthcare services, primary care, to identify chronic conditions early. Where are they going to go? They're going to end up in our emergency rooms. Not just at the 4 hospitals I'm talking about, but every emergency room in this county. That's going to result in longer wait times. And we all know what that means. That does impact the quality of care that any hospital provides in our community. So when we talk about the impact of HR 1 to the public system, it will impact every resident in every hospital, and every provider within our community. This is truly devastating, and I don't know that people will fully appreciate it until we're actually in the tsunami. Right? By that time, it's far too late. And that really is why we need to come together. There are 3 strategies that we've undertaken.
You
I
have to say
really
that.
want to talk to those.
But you have to say that. You have to say that for
I
my
have to say that for another question.
Yes, you have to say that.
I'll say that.
And I promise I will come back. Rachel, your union dealt with unprecedented emotional stress and loss during the COVID-19 pandemic, and county physicians were close to striking about 2 years ago over worker shortages, outdated equipment, and leadership challenges. So this has to be quite difficult as this unbelievable situation happens, and you're looking at, service line cuts, hiring freezes, billions of dollars lost in revenue, and how it could impact the doctors that care for the patients and all of the other medical people. So barring some miraculous turnaround of the federal government, which nobody foresees, what concerns you most on the counties as the county braces itself for this budgetary constraint?
That's a loaded question. I think what brought me to the union, because physician unions are few and far between, though we do see them growing across the country, is that physicians, we're told to be resilient, told to keep this for the weak, but we know that mental health negatively impacts our physicians. We know that suicide rates among physicians is high compared to our non-physician counterparts. And so where we are as a union 3 years ago and today is completely different. But I will say that our fear as a union is that the response will be for us to carry the weight and for us to be told to simply see more patients, take more call, put less. And we are resilient by nature for being a physician. We have to go through at least 4 years of med school. Some of us are 8 because they're getting they're getting their MD and PhD. And training can range from anywhere between 3 and 8+ years. So resilience is not an issue. Hard work is not an issue. But there comes a time where it's not as simple as seeing more patients or seeing more patients in a super amount of time. Specifically, our county patients, a large percentage of those don't even speak English. So when we talk about providing equitable care, quality care, we need to have time with our patients. A lot of our patients have several chronic conditions, unlike your typical Kaiser patient, for example. This takes time. And so it's not as simple as seeing more or doing more with less. Because if that is if that is the mandate, then we will lose physicians. And since I've been chair of the union, we interview every member that leaves county. And most of those are not retiring when they're leaving, but they're leaving because of working conditions, they're leaving because of burnout and inflexibility. So it is really important for us to be aware of that because, again, it takes a special position to come to county. We know we But again, it's the county's mission, the pursuit of health equity for all is what drives our positions here, and I want to keep these positions that really do lead with love and compassion. And I'm afraid we will lose them if, again, it's too more with us.
Thank you. Megan, in 2022, Santa Clara County Board of Supervisors declared a mental health crisis, mental health and substance use crisis in the county. In the last 3 years, the supervisors have worked to add more behavioral health services. Some of them, I think you did mention earlier, detox facilities, residential treatment facilities, we've expanded assisting outpatient treatment for those with the most serious of mental illness, and also behavioral health navigator program, just among some of the few things that the behavioral health department has done. The county also has launched Care Court last December and is now constructing the new psychiatric facility for children, will be the first in the whole county, as well as teens, and it also will provide a new wing for the adult patients as well. And that is, I believe, slated to come on board in 2026, somewhere early in that year. So, with all of that going on, the behavioral health department, as you said, is deeply reliant on Medicare dollars for that, all these things to come into fruition. But now we have these cuts, and we've heard that new expansion plans could potentially impact the ability to staff up. We've heard about the burn center, here we are having the mental health, new psychiatric, building coming online. So I wanted to ask you, what are your concerns about that, in terms of making sure that all of these programs, I know Paul is doing the night, making all these programs come to fruition.
Yes, so as I said before, 80% of our beneficiaries are on Medi-Cal, and Medi-Cal is our largest funding source. 23% of our revenue comes from Medi-Cal. For our outpatient treatment services, it's actually more like 50% funding mix. We have other local funding streams that for the kinds of services that the Medi-Cal program does not. So they are very they are very concerned with what her requirements, hospital patients, and other barriers to care. Everybody's not very real and serious consequences for our ability to continue to we do think this could impact the number of people we're able to offer care to, potentially in the thousands. These are really terrible steps back from the goals we have set to meet the public health crisis that has been taking place in our county. We are looking, of course, at all possible ways to support programs, including leveraging available state funding, leveraging Medi-Cal for those that we would make covered further. Just looking at other funding streams, of course, showing efficiency on all of our operations. We really have done a good job over the last 2 years meeting our goals to address the public health crisis. I'm just super pained to think about taking a step backward from that. Never mind slowing the work that we've already done, but having to step back because we don't have the funding to fill the positions to pay and provide contractors, public facilities, and provide the services to the need. And of course, we're looking at all possible options to continue to operate in this but we don't have to look at it.
I appreciate it, Ken. Thank you very much. Dolores, the clinics operate with a budget of well over $100 million. And although the community health partnership is not part of the county system, your services are integral to the county. What does this mean for for your partnership, and what are you concerned about in terms of the safety net situation?
Everything that Paul said, I did it, number one. what concerns me the most, and what I hear from the CEOs, which is my level of communications with the CEOs, is number one, the chronic disease rates in both of you all and with us. And they're the same people, same folks. Diabetes, we've done some work in diabetes along with the county for the last 20 years. If you look at the data, it's not really changing. So that is probably one of the worst diseases that I've ever encountered in my life. Those are the folks that are going to be hurt the most. The other piece is that there's when I started in 2011, the rate of Medi-Cal at the community health centers was about 20%, 25 at most. 2024, boom, up to 85 to 90%. And some of the folks are here. What's going to happen in 2026 is going to start dropping. So that's a big, big concern. The same issue, fair to say. Several of the clinics told me that they expect that from 2026 or immediately, 50 will be called back to their organization immediately. Somewhere between 8 and 15, right off the top. Now, the other piece that I wanted to bring forward, if you don't mind, is this is a very bad cake with many players. It's the money, it's the hatred that our community is working on and see every day, which impacts the region. It's the fear of leaving or being told to leave and leaving their children here. There was some policy, Rob was a mistake, did not pass about having more protection. There's the issue of the economy and the loss of jobs. So you are hitting, this is where we really see it. We are hitting a very specific population with 12 or 13 arrows all at once. It's really, it's unthinkable what's going on here. One of the issues too is that, as I said earlier, that these clinics were built initially for mommies and babies, right? We all know from a public health perspective that that's where you start. That's where health starts. And what will happen to those babies? What will happen? Will maternal deaths go up? Will children's deaths, infant deaths go up? They're pretty high when we started public health in the 90s. Those rates were very, very high. They're almost back. They're almost there. So that's going to be a big deal. I also think that one of the other concerns we have, and folks who are in the audience who are talking about this, is clinics get federal money for being a federally qualified health center. For us, that $1 million a year or even $800,000 has really helped with populations that did not become that or were eligible. It helps pay the bills. It helps buy more chairs, desks for your staff. So that at this point is still okay, but every day we watch it. It's called the court grant, the 330 grant. And I know you have that bill. There's also a grant from another organization, Federally Qualified Health Centers, attacking us, telling us that we spend too much money in non-medical services. So there's all of that in the climate. You know, this is probably not the place to talk about politics. But what's happening is the politics that are emanating from DC are flowing into our veins here. And folks are coming up with ideas on how to target that community that is my community where I come from. And that piece adds to everything else. Because I think that 1.7 billion it was embedded in there as
Well, it's all intertwined, right?
It's
I
all
mean, you
intertwined.
can't separate anything.
well, no, because our patients are your patients and your patients are our patients, since we don't do specialty care, there are exceptions to that. So it's this other piece that's really concerning us. It's destroying the whole population. every size color. Because it's telling me nothing. And another last comment here. When I hear from some of the patients when I talk to them, they are concerned, but they're more concerned about the relationship. So they're not hearing the help. They were working something about that, so we can talk about that later. Speak up or stop.
If I may, I just really,
Okay.
you might
Thank you.
follow up on something the board said. So we are very fortunate here in Santa Clara County to have a network of federally qualified health centers. And these federally qualified health centers generate their revenue to provide for the services to our community because individuals qualify for Medi-Cal. So when an individual does not qualify for Medi-Cal, how are they going to access care? Right? And so we have been very fortunate through the Affordable Care Act to get as many people qualified for Medi-Cal, right, over the years. We have an uninsured rate for our health system at around 2% because people qualify. And through those qualifications, these programs, we're able to provide for services to our community. Individuals that do not qualify for Medi-Cal, how are they going to access preventive health care? If they do, our federally qualified health centers are going to have to figure out how to provide that care. There's no resources. And that is a very, very delicate balance. Radical think about that. If they see a 10% decrease in coverage for their patient population, how are the qualified health centers going to be able to financially sustain that? That's a problem for our community. That directly affects our hospitals, as I mentioned, because they're going to wait until chronic conditions become acute. They're going to come to our emergency room. That are in hospital, they're going to have to manage that care with no reimbursement. And by that time, the cost of that care has now quadrupled, if not more so, because people put off care. We recently went through COVID, and after COVID, we know what happens. There was pent-up demand for services. We saw in our specialty clinics, people put off care. We're not going to see the doctors in primary care. And we also saw that in our hospitals. People were being admitted for acute conditions that could have been prevented should they have access to health care. So I just want to kind of make sure people understand that what impact this is going to have on our community. Because our community is built upon our diverse patients that we serve. I just wanted to kind of make sure that people are following the thread here of what impact it's going to have. Clearly, it's going to financially impact the healthcare system. We talked about the numbers, but we were talking about people's lives here.
No problem at all. Glad you added that to the conversation. Patty, do you want to weigh in here on how the nurses might be responding? I know you have some concerns about that.
I do have some concerns about that. My concerns, and this is, you guys might remember, we actually went on strike a couple years ago for a couple of things. One of them being wages. And my thought on that at the time still is that wages have to be competitive, and if they're not, our employees leave. So they go someplace else, wherever there is. I heard this morning on the radio that there's a nursing shortage out there, and they're short like 70,000 nurses in California or something like that. So that's a concern that we would have less staff, less qualified staff, and also have a big turnover in staff. We are, I mentioned before, we are a training ground, and as a training ground, then people tend to come, get the training, and then go where there's more money. And that's happened for a long time. So we have to stay up there in working conditions. We have to stay up there in wages, and if we don't, then we lose staff, and that's just basic math. So I have concerns over that. My concerns of, the other concern that I have is, if you've been in the position of denying somebody care, that's a really bad spot to be. It's, I'm ethically against that. And I'm professionally against that. When you see somebody that is sick and hurting, and you have the ability to help them, you do. And to not do that is my worst nightmare.
Before we move on to potential revenue solutions, I do have one question, Paul, that I'd like to ask you. And it's specifically to Regional Medical Center. The center was, it was a very bold move to purchase Regional Medical Center, and I don't really believe there was much option. So you found a way to get it done, the county found a way to get it done. And in that process, we know that HCA has stripped out a lot of services, which was one of the primary reasons that you all bought that hospital back, to get that back and restore those services. Nobody expected those cuts to come in, and so there was a plan in place. I know that the trauma center has been put back online. I'm just curious, I think maybe the audience might be too, what other services do you hope to put back online, considering the federal cuts that are now in place?
Of course, another great question. So let me just kind of back up a little bit about Regional Medical Center. So you're right, it was a very bold move for the county board to make a decision to acquire Regional. But in some respect, it's a pretty simple decision. Most of you know where Regional Medical Center is located. Right in the middle of a major populace of not just San Jose, but East Santa Clara County, going all the way into Milpitas, breaking past Milpitas, going down south, and then connecting with St. Louis Hospital. So that entire area is really what Regional Medical Center serves in terms of our community. 40% of the Medi-Cal eligible live within a 5-mile radius of Regional Medical Center. Think about that. We have 465,000 Medi-Cal eligibles or enrolled individuals in Santa Clara County. So that tells you how important Regional Medical Center is. But when HCA shuttered trauma services last year, in 2024, a lot of people don't appreciate this. Those trauma activations, trauma cases had to go somewhere. They went to Valley Medical Center. So in 2024, Valley Medical Center, this is in the state of California, was the highest trauma volume center, hospital in the state. Out of any hospital, in LA County, all the way up here. That is not sustainable. That is one of the reasons that Regional Medical Center was important to us. The reality is that on day one, when the county took ownership, we reopened trauma. Day one. We also reopened STEMI, heart care, and stroke services. And that's something we should all be proud of, because we are also looking at reopening labor delivery services next month. That was closed in 2020. Labor delivery. We also are bringing along with it the neonatal intensive care unit for our residents in that community. And we're being smart about it. We're working very closely with our physicians, our nurses, our unions, because what we know is that we have to be smart about how we go about doing this. So what we know about births is that in Clark County, which 80% of the medical health births are delivered by your public health care system. 80% of the medical health births. A large percentage of those individuals giving birth live in and around the regional health center. So of course, that hospital, in terms of providing services, is critical for our community, and we're looking forward to doing that. Problem is that as we talk about opening services, we're also confronted with $1 billion shortfall. So we do have to make difficult decisions, but our decisions are going to be based on the needs of the community, and making sure that we mitigate as much as we can these losses and focus on our patients. But it is not an easy thing to do.
Thank you. And you're also opening services that are considered loss leader, so to speak, right? They don't make any money, and that's not the purpose. The purpose is to serve, not to have the profits from the services. I mean, I know the EQ and behavioral health, they're not money makers, and that's not what regional, and that's what the county's about from everything we've heard. Okay, let's move on to potential revenue solutions, which I know everybody's very curious about. The county has placed, as you heard before, a 5/8 general sales tax measure on the November 4th ballot. And it's there to help plug the gap. If it passes, it'll provide $330 million a year annually for 5 years, which is the length of the measure. This is not right now something that's going on for 30 years. But if you do the math, that's about $1.5 billion. And if the estimates are correct, then the county will be down $4.4 billion. That's a $2.7 billion gap. So there has to be other options besides the tax. I guess my first question to you all is, how do you convince the taxpayers, or how do you tell the taxpayers that this is a general tax and the money is going towards healthcare and it won't end up somewhere else?
So, as we all know, the 5/8 sales tax is a general tax. It represents, as you point out, approximately $330 million. As a healthcare system, we're looking at a $1 billion deficit. So you have only 1/3 of our problem solved by this. The other third is going to have to come through operational efficiencies, restructuring of services. So no matter what we do here, we as a public health care system have to make some very difficult decisions. The sales tax will help, if you think about it, but it's not going to be the total solution to it. The other third, and this is something I think people need to realize, is that Medi-Cal is a state program. So it starts at the federal level, it goes through the state, then it comes here locally. So the state has a vested interest in supporting those providers, healthcare systems that serve disproportionately the Medi-Cal population, right? They have an interest to support the community health clinics. They have an interest to support our public health care system in Santa Clara County. And so we have to do everything possible to work with the state to see what they can do to help solve this problem. And clearly there's no guarantees of that, because the state have their own challenges relative to budget shortfall. But we have to work closely with them. A lot of people don't know this. So in the state of California, public hospitals make up 6% of the hospitals in the state, only 6%. But 50% of the trauma centers, burn centers, are provided by public hospitals. We train 50% of the physicians in the state of California, all all the public hospitals, the UCs, collectively, we train 50% of the physicians. The state should have special interest in supporting public hospitals. And we are doing everything possible to work with our delegation, our elected officials, and others to make sure that they lean in to support us. Now, as I mentioned, the state has its own deficit, but the reality is that when all said and done, without the tax measure, without the state support, we are left with a $1 billion hole in our budget, and we are going to have to make those difficult decisions. So any amount of funding that we can get in support for the community will make a difference in our ability to maintain critical and essential services for our community.
Now you can tell me what your 3 ideas are, how to make these better.
Well, those are the 3 ideas. So one, leaning in and asking our community to support us. We have to have local revenues. 2, we do have to operationally make some difficult decisions through restructuring, cost efficiencies, if you will. Last year alone, over the past couple of years, the county, working with our labor unions and others, identified 800 positions, right? Vacant positions to remove from the budget. That has helped us. So we're no stranger to making reductions in order to address deficits. But the magnitude we're talking about here is so significant. We need support for the other revenue opportunities. And then we have to really push on the state. We need your help to make sure that our state delegation and others understand that this is a collective effort. We have to work together to address this level that really is unprecedented. I do have to say this, so people have this appreciation, because people will walk up to me and say, why do you have 4 hospitals? And now we have this problem. We did not create this problem. We did not. If we were not sitting here today talking about this $1 billion challenge, we would be celebrating what we have here in Santa Clara County, the partnership that we have with the community health clinics. We'd be celebrating that we have 4 public hospitals that provide for the full continuum of care. But we are not in that situation because of the unprecedented actions being taken at the federal level. So I just want to make sure people understand that we wouldn't be having this conversation. These 4 hospitals in your public system, along with our partners, would be doing extremely well financially. And we would be looking forward instead of trying to figure out how to cover ourselves today, looking backwards and thinking about could we have done something different. But I think history will show you that the acquisition of regional medical center this past year was the right thing to do for our community. But we have to fight for it.
I'd like to ask the other panelists, and you can just raise your hand and say yes or no to this. Of course, we have no guarantee that this tax will pass. I don't know what plan B would be other than deeper cuts, which certainly is what nobody wants. But sometimes somebody has a think outside the box idea, and I was wondering if anybody wanted to chime in their own mind, think of what way could collaboration or where they think that something could be created to, I know it's not a magic wand or anything, but if any of you have any thoughts on this.
I was just listening to you talk, remember what happened during COVID, where folks did not want to come to county clinics to get vaccinated or or whatever the problem was. And Gardner, they created a partnership with the Mexican Heritage House. Thousands of people showed up. They showed up at 4 in the morning. Why? Because they know Gardner, the children were born with Gardner, etc. So this is a question and not one that is easily answered. Is this the time to as they say, think outside the box, yes, be creative, and think of those partnerships. And the problem still remains, there is no money, the problem.
Yeah.
But isn't this the time to sit down and think it through, what can be done at the community level? I'm not going to suggest any kind of professional changes, because it's not my place to do that. Plus, anyway, there is a tremendous amount of work being done in the community around education, health education, diabetes prevention, etc. Maybe we should start looking at those things. We don't do that per se, but I know that our community clinics and you guys, like public health is excellent at that. It's less costly. Problem is, a lot of it is not reimbursable, but I kind of defeats that purpose. But if we're really talking, as Paul just said, what we care about is patients. You and I will probably be okay. We'll get a job somewhere else, in another country or something, I don't know. But it's our folks who are truly suffering, who haven't left their home for weeks. We have one person we know, etc. So I think that understanding the specialties that some of our community health centers, not just ours, all the community health centers have, that perhaps could enhance or work with you on that. Perhaps that's an approach. The other approach is to bring in health plans. I know one of them is here, the CEO is here. And bring him into that discussion when it's time. Because you are correct. There's going to be a gap. We know there's going to be a gap. We know that already. So why not think about it? There may not be a way to do it together, but why not sit down and look at those issues? Do all the vaccinations. Does one clinic become the urgent care center for X? Things like that. I'm not a medical person, I'm not a clinician. I was a medical social worker. That's supposed to say that. That's what we've been thinking about. We've been working with philanthropy quite a bit. And we're finding that there are foundations who are interested in multi-million-dollar grants over 5-10 years. They've never done this before, but they understand. Now, where is that going to get you? Maybe a cup of coffee. We understand that. But they are interested. California County, for example, definitely. So we have a new director at the Health Trust, Dr. Ivy, who, as you know, is the king of health disparities, health equities. Your zip code defines your health, which is true. We're making some opportunities for that. You know, it's a different strategy that a hospital has, but do we really have a choice?
Thank you.
More than that.
Thank you.
Aside from that, which we support, of course.
Thank you, Dolores. Appreciate that. Rachel, you have some thoughts too?
Yes, a few thoughts. From the physician's perspective, when we are in medical school and training, we get a lot of training on, how to be a physician, how to do a procedure or a surgery, but we don't get any training on how to build. And this is something that we have already begun working with administration, but we don't give ourselves enough credit. And we're leaving money on the table by not billing to max, I would say. And so we're not getting credit for the services we provide, whether that's, you are calling over the patient, that could be a telephone visit. You're billing for a lower level of service, but we actually did so much more. So that is one thing. The other thing is sometimes, we do what we think is right for the patient in that moment, but there are certain idiosyncrasies. I learned one today, where if a patient receives their vaccinations in a pharmacy, that's reimbursable, but if they receive their vaccinations during their hospital stay, that costs us hundreds of thousands of dollars. I learned that today. And so these small changes, by just honestly education
May, do you want to add that? One, have to sit with me.
So yeah, I actually think, a big part of it is using the resources we already continue to have access to and making sure that leverage them appropriately. I know the community planning partners that we work with have been on a journey with us already. The behavioral health transformation in California through the medical program has been ongoing and really intensifying in the last couple of years. We've been in a big change journey to go from cost-based payment reimbursement model to fee-for-service. We're just starting to get the hang of that, kind of, when we find out about these large cuts in the state. So it's now more evident than ever that we really learn to maximize our ability to build Medi-Cal and other kind of related administrative funding resources. We've already been in conversation and collaborating with our contracted partners about how we can continue to support programs by leveraging all of the sources and local sources. In behavioral health as well, and we have a few dedicated funding sources. I should say that this is becoming the HSA. It's a valuable funding source that changed the landscape of behavioral health care in the early 2000s. It is also the tax-based funding source subject to the quality of the economy. So, in addition to the changes in medical health, another concern is the impacts to our overall economy of decreasing health in our population and other policies that are changing employment rates and all of that, and what those will do to our local resources. So absolutely just want to amplify working together collaboratively, transparently, and creatively to find solutions and to continue the
Thank you. Patty, do you want to add anything also?
Yeah, I'm gonna just continue on the vein of collaboratively working together. One of the things I have no idea how to close this budget gap, but there are a lot of good ideas out there. And so listening to those ideas, plus I was once had the privilege of being in a committee with our physicians, inpatient, outpatient, public health, behavioral health, everybody working on a common problem. And that's part of the magic of having county hospital that's plugged into public health and community services, that you can sometimes attack things from many different angles. And so that efficiency is already there because it is a comprehensive health system. So those getting more collaborative, yeah.
Thank you. We are out of time, actually, and I had one question, and I think we actually addressed it. It had to do with how we bail out the situation and some of the strategies. So I think that's what you're saying. Any last words? We have about 2 minutes. Make sure. Okay.
I didn't even know this later, but we have, for the Help Us Medicare Family Health Plan, the Health Trust, and another foundation, I can't remember which it is. We are launching a huge campaign to keep people who are on Medi-Cal, to keep, not to really do that. And we're doing it in all languages, we're holding town hall meetings and bringing attorneys to help people understand. We're providing patients' rights and education, establishing a call center, ICH, that we are implementing. Plan to assist families with tools, training sessions, and data accuracy to address quality measures, which bring now great revenue. So we're launching October 1st, and that's very community-based in order to keep people on Medi-Cal as long as possible. We don't want them to take off as they are starting to draw in. So, thank you.
Any closing remarks?
Dr. Rich, you want to go first?
Sure, I'll keep it short. I just wanted to just reiterate that the impacts of HR 1 affects every single person in this room today,
anxious to say this to all of you. The provision of healthcare cannot be accomplished without our physicians, our nurses, our staff. And we are very fortunate, not just at Zachary Valley Healthcare, but I think in all of our clinics, where we have providers that really do the heavy lifting every day, caring for our patients. And it is true that safety net providers, the burden of care is going to fall upon us. Because where do patients go when they do not have access to health care, do not have health care coverage? They come to our public hospitals, they go to our community health clinics, because they're coming to us at a time of need, right? I just wanted to really express my gratitude to the workforce because they have gone through COVID. We have seen the number of patients coming to our clinics and our public health care system. So behavioral health continue to grow, needing access to care, and frankly, that is not going to slow down. So we do have to take care of our healthcare workforce, find that right balance so that we can continue to provide quality healthcare to our residents. So I just wanted to acknowledge that and just, again, express my appreciation to everyone. It is about coming together to address this problem.
Well, thank you, and that is the conclusion of our State of Healthcare in the Silicon Valley Forum. I want to thank our panelists and Ms. Claus for their insightful. I'd also like to thank everyone who tuned in tonight. We were recording tonight's forum will be available on our YouTube channel, and a recap of the story will be published early next week. And I also want to thank our sponsors for their support, and I hope you all have a good night. Thank you very much.